Hello, everyone. I'm Heather Rouse, Director of Iowa's Integrated Data System for Decision Making, faculty member in the Department of Human Development and Family Studies. And I'm Dorius, the co-director of I2D2, and we are so happy to be here for the ISU Faculty Research Day and to talk with you about some of the work that we've done to improve the lives of vulnerable families here in Iowa. So if we think about social problem solving, especially in government, it kind of feels like this Gordian knot, where oftentimes, whether it's health or education or social services, we pull at one part of the problem only to make things tighter and harder in another part of the problem. So we don't essentially solve these big global problems. Our systems are making decisions in silos, but we know people don't live in silos, especially young children. They often come into contact with many different programs and services, and they need us to have a more comprehensive approach. Our vision at I2D2 is that our system of early childhood programs and policies will be informed by rigorous data analysis that uses integrated data in collaboration with state partners to direct services and resource allocation. We essentially put people in the middle and use evidence to drive cross-systems research. So how does this work? Well, essentially, administrative data sits in silos. We bring these data together, integrate them at the individual child level, and analyze it to answer complex problems. One of the things that we like to say is that if you ever want to integrate data, you have to integrate people first. And so we use the community learning through data-driven discovery model of stakeholder outreach. And when we do that, that means that we have data at our very core, but the real component we think about is how do we work with stakeholders to understand what their needs, the data they have available, the sorts of answers that questions that they're trying to answer, and then the decision-making points that they're going after. And we do this in an iterative cycle of dialogue, data, and decision-making that goes over and over as we try to address these really complex problems from multiple angles. Some examples from our work. One of the first projects we did was a comprehensive statewide needs assessment of early childhood, where we were able to document for the first time unduplicated counts of children across preschool. Historically, we knew children that were enrolled in education programs through the Department of Education or Head Start programs over here or other childcare programs, but we couldn't tell you how many of those children were the same kids. And therefore, how many kids across our state were not accessing any of those programs. With I2D2, we can look at that. We can look at unduplicated counts of kids, and then we can see where are there pockets of families that may be accessing services or maybe underserved that we could help create strategic targets to focus and bring families in. Part of this work is now being used to think about our childcare situation in the state of Iowa and support childcare businesses and address the gaps that we have in childcare across the state. Another example of the work that we've done has been with substance use. Iowa has a substance use problem, and this goes across generations. And so thinking about how do we access the sort of administrative data that gives us leverage on who are the families that are most vulnerable to this, and where does the vulnerability start from a child's perspective, from the time of birth and through their early years. And so we carried out a project in consultation with the Department of Public Health and the Department of Human Rights to look at this over time. And the results of the project were then shared broadly with lots of stakeholders, including directors, the director of agencies, the directors of different bureaus, as we thought about solving whole person and whole family problems. A result of some of this work has been a renewed focus on building a recovery infrastructure in the state, which we've been very happy to be a part of. And over $15 million in new federal funds have been requested using data that we've provided to help get new infusions of resources to the communities and people who need it most. We've also done research in home visiting. We have a vast network of home visiting providers in the state of Iowa, funded by lots of different sources, some of them with federal funding through the Department of Public Health, some of them through prevention dollars through Department of Human Services, others through Early Childhood Iowa to provide family support across our different regions in all 99 counties. Some of the research we're able to do with I2D2 helps to document where there are areas in the state where families with certain characteristics and risks may benefit most from home visiting services. So we can create outreach around those. We can also look at families in different types of programs and what works best for which families under which circumstances.
Another area where we've been growing is in this understanding geographically where people are in the state and what their needs are. So on the bottom right, you see one of our early reports of mapping vulnerabilities. And this was in response to listening to Early Childhood Iowa leaders and directors from out the state who needed to be thinking about what are the reports, what are the needs of their area. And as we've begun collaborating with them over time, we realized that people really need to close this gap from data to action much, much faster. And so we've been developing a dashboard that will now do this in real time or much closer to real time, as well as, and critically, we're able to provide information that's not just at those census level aggregates, which in rural places like Iowa often mean using rolling averages. But now we can get into information at the individual level to give more nuanced understanding to our state leaders and to local leaders about what the needs are in their geographies.
So come check us out. We have a newsletter, sign up and hear information about what we're doing. We provide routine sound bites and data bites around what we're learning across the state. You can check out our website, subscribe to our newsletter. We have social media accounts as well. We would love to hear from you. Give us your ideas about ways that we can use this wonderful system to really help strengthen our supports for children and families.